everyone. Today's topic is local anesthetics. Anesthesia or anesthetics produces the loss of sensation in localized area by using special drugs or by using the drugs which produces the loss of sensation in localized area. So local anesthetics are these are the pharmacological agents which when applied or injected they blocks the conduction as well as generation of the impulses in the localized area without affecting the degree of consciousness. It produces the loss of sense in localized area for restricted interval of time. Local anesthetic stops the body to sending signals to the brain. Then how local anesthetics works? Mechanism of local anesthetics. Local anesthetics after the application they acts on the outer part of cell membrane. They decreases the membrane permeability to sodium and potassium ions. Now, calcium controls the passage of sodium across the cell membrane, and during this sodium ions goes inside and potassium ions goes outside, and this causes depolarization, thereby it produces the contraction. And after the application of local anesthetics blocks the calcium ions and they interferes with the transport of sodium across the cell membrane, so thereby it decreases the transport of sodium. Due to this, sodium ions does not go inside and potassium ions does not go outside, thereby it produces the relaxation. Due to this, action potential across the cell membrane is blocked and it results in anesthesia. Now, ideal properties of local anesthetics. Local anesthetics should not damage to the nerves. They should be non-irritant to the muscular tissue. They should be effective topically as well as parenterally. They should possess quick onset of action and sufficient duration of action to complete the surgical procedures. Techniques of application of local anesthetics. It includes topical anesthesia, which is also known as surface anesthesia, infiltration anesthesia, block anesthesia. Block anesthesia include field block anesthesia and nerve block anesthesia, then spinal anesthesia and epidural anesthesia. Now topical anesthesia. Topical anesthesia are applied in the form of creams, ointments to the specific site or localized site. For example, ear, eyes, skin to reduce the pain and itching. Drug use is lignocaine. In infiltration anesthesia, the drug is infiltrated subcutaneously and nerves are anesthetized by direct exposure to the drug, and this is used for the minor operation like removal of cyst, for example procaine and lignocaine. In spinal anesthesia, the drug is injected into the subarachnoid space, which is useful in gynecological surgery. In epidural anesthesia, drug injected outside the dura mater, which is used in lower and upper abdominal. And in block anesthesia, in field block anesthesia, drug injected into surrounding area, and in nerve block anesthesia the drug is injected very close to the nerves for the minor operation, for example procaine and the lignocaine. This is about the local anesthetics. Local anesthetics produces the loss of senses in the localized area for the restricted interval of time. And how it works? It works by blocking the action of calcium ions which interfere with the transport of sodium across the cell membrane, which decreases this transfer of sodium. And due to this, sodium ions does not go inside and potassium ion does not go outside, thereby it produces the relaxation, and due to this action potential across the cell membrane is blocked and this results in the anesthesia. Thank you so much for being there.